We're speaking today with Dr. Lee Beers, president of the American Academy of Pediatrics, representing 67,000 pediatric medical professionals. The Academy just released its guidelines for safely returning children to the classroom during the COVID-19 pandemic.
Dr. Beers is the medical director for community health and advocacy at Children's National Hospital, and she's the founding director of the DC Mental Health Access in Pediatrics program. She's also the co-director of the Early Childhood Innovation Network. Dr. Beers, we welcome you to Conversations on Healthcare.
Thank you so much for having me. I really appreciate it.
Yeah, and Dr. Beers, you know, what a difficult time for families with school-aged children. There's sort of both the joy of going back to school, which is so exciting, but the nation's really reeling from another surge in COVID-19, and it really fueled by the Delta variant. And we're seeing a disjointed approach to back to school protocols as the virus surges across the country. And I'm wondering how your organization is offering guidance to families and to clinicians and educators as millions of kids are now some have already started, many are waiting to go back, and particularly focus in on children and young people who are now getting sick, because I think that's a worry that families have.
No, absolutely, and thank you, because you're right. It really is. It's an incredibly timely question, and I'm sympathetic. I have 2 school-aged children myself, so we're in addition to thinking about these things professionally, we think about them in our own house too. So I know it's a challenge for a lot of families. You know, I think there's a couple of things. You know, you mentioned as we started that the AAP, American Academy of Pediatrics, has guidance around safe return to schools. And I think one thing that I always like to emphasize is that that's actually guidance we've had throughout the pandemic. And just like all of our guidance around COVID, we review and update it really regularly. Actually, about once a month, we take a look at it and make sure there's nothing to, nothing that's changed, nothing that needs to be updated. And the real key sort of behind our guidance is one, that it's incredibly important for children to be in in-person school for all sorts of reasons, which we can talk about. Yeah. And I think I probably don't have to convince most people of that. But 2, that we can do that safely with good layered precautions. And I think it's those 2 things together that are so important to talk about, you know, both the importance of return to school, but also the fact that to do that safely, we really have to layer precautions to help keep our children safe. So, you know, and I think some of the things that we're doing, certainly just even by putting out the guidance, we really hope and have seen that be helpful for communities and pediatricians. We also have information on our website for parents. We have a great parent-facing website called healthychildren.org. And so it's a place where parents can, you know, go find answers to a lot of those questions or things that are worrying them as we get back into school. And we've also had some great partnerships with teachers. We're actually getting ready to launch a partnership with the PTA, the Parent Teacher Association, where we'll match up pediatricians and school districts so that they can work together to help answer families' questions about anything related to safe return to school.
Well, Dr. Beers, I want to start with your most basic recommendation. That's that all children aged 2 and older should be masked in school and daycare settings across the country. I'm kind of amazed that I'm presenting this one as an issue for which we are now seeing protests in many communities. My own community, I've seen the lawn signs pop up and people have been at the Board of Education meetings, but this, what would seem like most basic public health intervention has become very charged politically, and it's turning out to be quite a divisive issue. I wonder if you'd like to take this opportunity to talk about the science that drives the American Academy of Pediatrics recommendation on masking, and if you'd like to share, where you think this resistance is coming from with regard to children. I think our listeners would really be most interested in hearing that as well.
Yeah, absolutely. And I think like you, gosh, sometimes you do feel frustrated and concerned about the division around this issue. And I think our recommendations about this really start from the place of remembering how important it is for our kids to be safely in in-person school. And we know, over the past year, we've seen school districts be able to do that safely when they layered precautions. And we've seen school districts where it didn't go as well because they didn't have those layered precautions. And so, when it comes to masks, they really are a safe and effective way to decrease the spread of COVID. They're not 100%. Nothing in life is 100%, but they do really dramatically, when used consistently and when used by everybody, decrease the spread of COVID within school settings. So, we've seen examples. For example, there was a study looking at school districts in Georgia where comparing some which had universal mask mandates and some which made it optional. And the schools where there was universal mask wearing had significantly decreased spread of COVID within those school settings. And I think we also know, right, as physicians, we've been wearing masks for a long time in a lot of settings. This isn't something that we really it's something that we've known that masks can prevent the spread of viruses for a long time, and it's just a slightly different setting that we're putting them in. I think some of the other questions that come up are, how can our kids do this? It's none of us love it, right? Right. And so is this okay for our kids? And I think also what we've seen is that kids really adapt very well to wearing masks, especially if the adults around them just approach it calmly and just help them to know, what, this is something we're doing. It helps keep you safe and healthy, but it also helps keep your friends. It helps keep your teachers. It helps keep your neighbors safe. It's really about, my son is a 13-year-old, a young teenager, and we were talking about this a little bit, and he said, what, he's like, I have friends at school who have things that might make them more sick with COVID. Why wouldn't I wear a mask to protect them? And so I think, it's really, kids really do understand that. And they really do understand the importance of keeping each other safe when we talk to them about it. And I think one of the things that I do find hard about all this division around masking is that, I think, again, we've seen in a lot of different ways that it's a safe and effective way to decrease the spread of COVID. And the more divisive it gets, the more it takes away from our ability to really focus in on all the other things we really need to be doing too to get the pandemic under control. From educating people about the safety and efficacy of vaccines, from doctors in their clinics, working together with families to answer their questions. So it's I think that's one of the things that I have found hard about it is that it takes away from some of these other things we need to do. It takes away from our focus on making sure the kids have a good transition to school and that they're getting the social emotional support that they need and the educational support that they need. And so, I'm hopeful that as we move forward and we start to see that, those schools where they're not mandating masks are having a harder time, I hope that we can kind of come back together on this.
Well, that was great common sense advice. And thank your 13-year-old. Out of the mouth of babes really comes really the message that hopefully we spreads to other young people and to their families. I guess the $64,000 question is, what's the timeline you expect for younger children to be approved for the vaccine? Right now it's 12 and over, and what's your sense of, is this going to be 2 to 11 and then we'll go from birth to 2, or how does it look? And maybe tied to that is, we still have a majority of our American parents who are reluctant to vaccinate their children. And really, what is the Academy doing around empowering pediatric practitioners to carry the importance of that message to their patients?
Yeah, I think it's the question you just asked about, when will the vaccine be available for younger kids? I think that's the most common question I get these days. I wish I had a crystal ball. I think from what we're hearing, I don't think it'll be too long, sometime in the fall. of course, we don't know for sure because it really, it's a decision by the FDA, and it also depends on what the FDA, what the decision that they make when they review the data. This is a really important part of our vaccine monitoring system, is to trust the folks at the FDA to do their job, to really carefully review the data. I would say, I think what we're hearing is that the next group that's likely to be authorized is 5 to 11, and then shortly thereafter younger than that. So I think it will come in phases. We also, though, I would say at the AAP, we have been just really trying to emphasize that we do need to be treating this with urgency. I think, gosh, like so many things in our world, in our healthcare system, children are sometimes an afterthought, or sometimes we don't prioritize what they need in the same way that we prioritize what adults need. And so I think we've been really pretty public about saying we do think that we need to be approaching the authorization of vaccines for younger kids with the same urgency that we did for older adults, because we're grateful that children, it's such a good thing that children are at less risk for severe infection than adults, but they still can get very sick, and any preventable illness is one that we want to prevent. And I think then that gets down to your question about questions or hesitancy that families may have. This is probably the only time in our history where, or at least in our recent history, where most of the general public has really a good idea about what the vaccine development process is. This isn't something that most people thought a whole lot about before recently. So gosh, of course, folks are going to have questions. I had questions before I got the vaccine. I had questions. Both of my teenagers are vaccinated. I made sure I had my questions answered. So, of course you're going to have questions, and you want to feel confident that the FDA and the other regulatory systems are doing their job, which they absolutely are. And so part of what we're doing for pediatricians is just, making sure that they have the resources to share information with their patients. We've got, materials, handouts for parents. We're soon actually getting ready to launch some videos that we call them science explainer videos, where they kind of talk through the science of the vaccine, so that we can share those with families and parents. We also have a lot of resources for the pediatricians, for our members, about how to get the COVID vaccine into their own practices, and sort of what some of the tips and tricks are to do that effectively, to make sure that our practices can have the COVID vaccine available for their patients. So lots of support, and I think, frankly, this is for pediatricians, but for all physicians and healthcare providers, they've been working really hard for the past 18 months, and so the more we can support our members, the more we want to, and we know it's been long, hard year and a half, so we want to do everything we can to support them.
Well, Dr. Beers, speaking of vaccines, and this last 8 months has been all about vaccines, but we noticed when the pandemic hit, and for good reason, pediatric visits just plummeted, right? People were afraid to come in. We saw instant delays in immunizations and all the other very important things that happen at well-child visits. And there's kind of a auto course correction, I think, over the last several months, as people felt more confident going back into practices. And now the Delta variant is here, and people are reading about its uber transmissibility. And I worry that we're going to see yet another retrenchment from people being, frankly, afraid to go into another office with lots of kids and parents to get their routine care when there's still no vaccine available for the little ones, and when Delta variant is on the rise. I know that you all have been really thinking about and strategizing on what kind of adjustments or accommodations do we need to make to protect children from all the conditions for which they get vaccines, and also those very important screenings that take place in well childcare, even beyond vaccines. Is there any more flexibility with timing or scheduling, or how this work is accomplished, where it's accomplished? What are the discussions that you've had in the Academy about that?
Yeah, well, first of all, thank you for bringing it up, because I agree, it's really quite important. We have seen some pretty dramatic decreases in routine childhood immunizations over the past year for all the reasons that you describe, and I think while none of us are happy that this has gone on for a year and a half, I think one of the things out of that is that now our pediatricians' offices and all of our doctors' offices know what they need to do to keep families and patients safe while they're in your office. And so I was so impressed at the very beginning of the pandemic when this was all very new and practices had to really pivot, just within very short periods of time, how much creativity and innovation and commitment there was to making the office safe. We've got pediatricians in offices who are going out to the parking lot to give vaccines. We've got, they've separated out their clinics, so sick and well. They've made changes to their schedule. So maybe you see all your well patients, or, first half of the day, your sick patients the second half of the day. So lots, it depends on the office and the setup, of course, but lots of different accommodations and adaptations have been made to make sure that our offices are as safe as possible. And of course, wearing masks keeps the spread as well, helps keep everybody safe. So, and I think also, again, it's about sharing that information and getting information out to pediatricians, but also to families and the general public. We've really tried hard to do a lot of that. We've done a lot of media about it, talking about how important it is to get back in. We've had some little videos and public service announcements that we have out there to, and I think the final thing I would say about that is just, for some families, it's fear. For some, it's been a hard year. And so, if there's something, things slip through the cracks. And now, it's been a while. We want to make sure that everybody's getting back in so we can get kids up to date on all their shots, but also, all those other things that you mentioned that are so important, chronic disease management, screening for mental health concerns, developmental issues, all of those things.
We're speaking today with Dr. Lee Beers, president of the American Academy of Pediatrics. They just released guidelines for safely returning children to the classroom during the COVID-19 pandemic. Dr. Beers, you've been a longtime advocate of advancing community health and with really a particular focus on social determinants of health, housing and food insecurity, transportation issues. And I'm wondering if you could share with our listeners some of the research you've done in this area, and also, how might some of the interventions, such as school-based health centers, where children, as we all know, spend most of their days, offer a more efficient, effective, hopefully elegant approach to assessing and addressing child's needs, especially our most vulnerable children?
Yeah, no, thank you for that. Because I think, you're exactly right, is that there's so many different influences on the health of a child and a family. And I think, in many ways, one of the things that underlies a lot of the work that I do is really, the belief that we want to meet families where they are and provide care and services in the most accessible place. And so sometimes that means where patients, live, go to school and play, right? So, so schools are a perfect example of a place where, we can provide support. School-based health centers are a, tremendous part of our medical community. They, particularly for our older kids, but also for some of our younger kids too, we have school-based health centers. And so, we can, make the care really accessible. The students in the school and the families in the school really get to know the school-based health center staff, so they feel really comfortable with them, and they can ask them, questions that they might be embarrassed to ask someone they don't know as well. So that's a really important piece. And I also think even for those schools that don't have school-based health centers, our school nurses are also really tremendous partners. We've got some great examples across the country of school nurses really partnering with their communities and with their school systems to, give information about COVID-19 or partner for immunization delivery, things like that. So I think that's been that's been a really important piece. But ultimately, we want to try to find the places where patients and families and kids just feel comfortable and safe, and able to have their questions and concerns answered.
Great.
Dr. Beers, I think the school-based health centers are such a powerful tool in that way. But there's also been a movement in the country for several years now towards pediatric practices embedding behavioral health specialists, interventionists right within the pediatric practice as well. I wonder two things, maybe if you could both speak to, is that a trend that is growing, that we're going to see more of, that parents might expect that there would be a child clinician or psychologist available to see their child? But also maybe comment on what are your colleagues seeing in terms of behavioral health disruption or symptoms? Because my guess is it's going to call for some new strategies and some new ways of supporting people based on what people have been through in this past year. So if you could comment a little bit on that, both the integration within pediatric practices, but also what these pediatric practices say that they're seeing in young people after and during this pandemic.
Yeah, absolutely. And I'll almost take your second question, or I will take your second question first. I mean, I think, I mean, anyone listening knows that we have actually really been in a mental health crisis for young people for a long time now. This predated the pandemic, and the pandemic has really accelerated that. It's made it much more acute, and it's also just like it's harder to access a lot of things right now. It's harder to access mental health services, which were already really hard to access. Some of the things I still, it sort of burned in my memory, a comment from a pediatrician in another area of the country who said, I have treated more kids in my office for mental health concerns this month than I have for ear infections. And so I think that speaks to the scope of what we're seeing. I was talking to a group of pediatricians not too long ago, and I said, part of what we do as pediatricians, often we're sort of the first ones many times to see when an issue is starting to bubble up, because we're hearing about it from patients, one at a time, but we're really you start to get a sense like, wait, everybody's calling me about this. What's going on with that? And next thing you know, it's showing up in the data. And I think mental health is very much like that. And there's a lot of reasons for it. I mean, of course, the disruption to school and the social isolation plays a role in that. But many families have also experienced grief and loss in their family. They've had economic disruptions that are very stressful for their family. We have a lot of concern about increased, violence or abuse in the homes during this period of time. So any one of those things could be contributing. And so then that gets to the first part of your question, which is how do we address that? We know there just aren't enough child psychiatrists across the country to meet this whole need. And so we do have to think about how we do things a little bit differently. And I think just like with the school-based health centers, having mental health care in a place where families feel comfortable and a place where it feels less stigmatizing is a really important strategy. I think the other thing, again, getting back to what I said about, sometimes as pediatricians, we see things early. And when you see mental health concerns early and you can address them early, they often are less acute in the long run, and we can really help make sure that kids are healthy and thriving. And I think those are things we really can do in the pediatrician's office. Now, sometimes concerns are more acute or severe, and they really do need much more specialized, in-hospital mental health treatment or day treatment or things like that. And we can help make sure that kids get connected to that. But I do also then, just as a global statement, agree. As we move forward and come out of this pandemic, I do think we're going to have to really look critically at our mental health system of care across the country, because it's just not designed to do all the things we need it to do right now. And so we are going to have to think differently about how we do that.
Well, I like your optimistic note that we're going to get through this pandemic. That's so important. And I do want to pull the thread on Margaret's question about strategies. And thank you for talking very frankly about the behavioral health issue that children have and the role that pediatric practices play to have that communication with your clinician there is so important. So thank you for highlighting that. It's not just the physical side that the pediatrician's looking at. They're really looking at the whole young person in front of them. And there are going to be changes to the way we approach healthcare. I think telehealth has been a force multiplier. And I'm wondering, are there other ways that you're seeing, in addition to telehealth, innovative approaches As we think about this new model of delivery, because we're still in the midst of the pandemic, we are going to get out of it, but it's going to have a profound impact on practices. What are you seeing out there?
Yeah, I think that's exactly right. And I would echo your observations about telehealth. This is one of these things that in medicine for a long time, we've been talking about how great it would be to do more telehealth. And boy, that accelerated really quickly over a very short period of time. And that's good.
Yep.
I think there's some really good things about that. And that's going to be part of improving the mental health system of care is more, more accessibility to telehealth, because that's been really, really, really powerful, positive thing that's come out of it. But I do think that you're right. We are going to have to start thinking innovatively. I mean, one of the things that we have been thinking a lot about in pediatrics is, what does our well child visit? What kind of things do we do at our well child visit, and how is that is set up, and how do we really better focus on the preventative and family support things that come up in those well visits? I mean, pediatricians do a great job of this, no doubt. But I think at the end of the day, sometimes our financing systems aren't set up to really support all those things that we do at those visits. And so I think that will be one thing that we're thinking about, and I think that we'll all probably think about in the future is, what do those visits look like? There's an increasing discussion and understanding of the importance of, sometimes we call it relational health, sometimes we call it two-generation approach, but essentially the bottom line is that the family health and mental health so integrally impacts the child's health and mental health. And so how as pediatricians can we best support that? We're not adult doctors. We don't want to be, we went into pediatrics for a reason. But we do know that the family is an important part of the child's health. And so how can we as pediatricians best support the family? So I think that is one thing we're really, really thinking about. I think another piece that's been so important, and that I think we are actually seeing some good awareness and innovations on is around immunization delivery and vaccine hesitancy. As I kind of mentioned earlier, we're as a nation, we're talking about this more than we ever have. As pediatricians, we've faced vaccine hesitancy for a long time, but there is, I think, a much greater understanding and public will to be thinking about how do we combat misinformation, how do we promote confidence in vaccines, and so I think there's a lot of opportunities for partnership and innovation there as well.
We've been speaking today with Dr. Lee Beers, president of the American Academy of Pediatrics, which represents 67,000 pediatric medical professionals in North America. Access their latest recommendations for sending children back to school amid a resurgence of COVID-19 and all of their important work by going to healthychildren.org, or you can follow them on Twitter at AmerAcadPeds. Dr. Beers, thank you for your lifelong dedication to the health of children, for addressing health inequality in children and in pediatrics, and for joining us today on Conversations on Healthcare.
Great. Thank you so much for having me. It was such a pleasure.